La salud no solo se atiende, se cuida, se acompaña, se vive. Conoce Health for Life, un espacio donde abordamos tu salud de forma holística. Aquí podrás tomar un rol activo en tu salud física y mental, creando mejores hábitos con una comunidad de apoyo y el respaldo de los expertos de TecSalud para lograr una vida más plena. Visita Health for Life en el 5º piso del Hospital Zambrano y conoce un espacio dedicado a tu salud. Health for Life, contigo por una vida larga y sana. TecSalud.
Bueno, yo creo que no hay mucha gente, así es que Tani y yo somos los maestros de ceremonias. Y muy buenos días a todos. Voy a hablar, Mimi, in English only an introduction. Tanya warned me not to speak in English, so I have to follow my boss here. So she doesn't want to give me space in the new clinic, so I have to. So we're going to do a brief introduction about the history of how we came up with this, and then we'll have Tanya talk to us about what we're going to do. Pero I'm going to switch to Spanish now, and then I'll give you another update. Pues muy buenos días a todos. La verdad es que estamos aquí después de algunos años y después de COVID. Y COVID nos interrumpió un poquito los planes, pero por muchos años, la verdad, en el tema de salud, yo creo que los hospitales no hacen mucha conciencia del tema de prevención, ni tampoco hacemos mucha conciencia en el tema de nutrición o de una estrategia prolongada de prevenir. Y yo creo que en parte, aquí está Ale, no te había visto, Ale, en parte Tomás y Ale a mí me bombardeaban con ideas de prevención y de temas, y tú no te acuerdas, pero tu hermana me invitó a bueno, y tú también a un tema de un foro aquí, una plática que me hicieron a mí pensar en algo de prevención. Y por los que ustedes no saben, yo en Estados Unidos me dedicaba a trasplante de corazón, y trasplante de corazón, pues la gente, ahí ya no hay prevención, ¿verdad? Es el último estadio de todas las condiciones de enfermedad. Pero después, y lo que yo sí me di cuenta es que la gente, después de que le das el trasplante y trabajabas con ellos para tratar de que hicieran un nuevo estilo de vida, pues al paso del tiempo no lo hace la gente, y no porque intrínsecamente haya cierta maldad. Cambiar un hábito es un tema difícil, no es nada más mala voluntad, es una complicación de vida, ¿verdad? Y hacer buenos hábitos, pues es trabajo, es tiempo, es rutina, es hacer momentos de tentación heroicos de cambio, y no está fácil. Pero entonces yo no culpabilizo, pero esa era una realidad. Entonces yo me dedicaba a hacer trasplante, y la verdad nunca me dedicaba a temas de prevención. Estábamos nada más pues en el momento final, y ayer Mimi y yo platicábamos en lo que hacemos de cardiología. Pues sales con la sangre y dices, salvé la vida. Pues no salvas la vida, la verdad, la mayoría de las veces no salvas la vida, pero es estimulante para el doctor. Entonces los doctores a veces no ponemos suficiente atención. Y entonces yo sí me he quedado un poquito, Tomás, adelante. Yo sí me he quedado un poco con la deuda de, Tomás, pásale, de tratar de reconvertir un poquito la estrategia de salud en una estrategia que esté más enfocada a prevención. Y en un viaje que teníamos en Seattle hace muchos años, donde estaba Salvador Alba, que era el presidente. Salvador era un futurólogo muy visionario, muchas cosas. Entonces me retaba mucho. Bueno, ¿y qué tenemos que hacer diferente en salud? Dice, bueno, pues trasplante y válvulas y todo eso, it's exciting, but not maybe the most significant. So 2-3 years ago, when we were in a trip in Seattle, in Vancouver, I think we came up with the idea that we wanted to do bienestar, prevención y longevidad. So wellness, prevention, and longevity as the trademarks for what we want to do in the future. So we want to be able to fix what's not fixable, but we need to address the illness before it starts. Y yo creo que eso es un poquito la base de lo que ahora estamos haciendo, y también reconocer que hay muchas otras cosas que los doctores no aprendemos. Por ejemplo, pues los que ustedes son nutriólogos que están aquí, pues nutrición no le damos los doctores mucha importancia, la verdad. Y sí es cierto que ahí empieza el problema, ¿verdad? Ahora, en otro comercial en paralelo en el TEC, hemos construido una visión de investigación, y uno de los pilares de los 3 institutos de investigación se llama The Institute for Obesity Research. No es un tema unifactorial, es un tema que vamos a ver desde múltiples múltiples áreas para tratar de combatir la problemática, pero los alimentos es un tema importante. Entonces, el tema de nutrición, el tema de actividad física, el tema de paz mental y también integrar en la práctica de medicina como la nuestra, pues algunas otras técnicas que sabemos que pueden funcionar y no necesariamente entendemos el todo. Entonces, esa es parte de lo que hoy estamos creando. Y Tania, pues va a ser la persona encargada de llevar esta visión a una visión real de práctica de atención a la gente y pues con ayuda de algunos y muchos de los que están aquí. Entonces, Tania, platícanos un poquito y yo me voy a ir a sentar.
Ok, está
porque
bien.
mis rodillas ya no me aguantan, pero si me
Cateterismo de
vuelves a,
hoy ya no.
pues es que no todo es prevención, pues ni modo.
Bueno.
Sí, para mí el golf es un deporte extremo, entonces tengo toda la espalda chueca.
¿Sí se escucha? Sí, ok. Bueno, pues muchas gracias a todos por hoy estar aquí. Es un gusto para mí poder verlos aquí. Para nosotros, como ya dijo el doctor Torre, TecSalud está comprometido con ver un enfoque más allá de la enfermedad y lo que queremos es empezar a generar modelos de atención que realmente empoderen a las personas y que podamos guiar a las personas a una salud mucho más integral. Entonces, Health for Life tenemos que verlo como la manera en que esta estrategia de bienestar, prevención y longevidad que tiene ya muchos años trabajándose y estudiándose, cómo se hace tangible y verlo más allá que un espacio físico en el 5º piso del Zambrano como un modelo de atención que va a buscar empoderar a las personas a través de diferentes pilares, ¿no? Los pilares asistenciales, o sea, todos esos factores clínicos que podemos hacer directamente con el paciente día con día, la investigación y la educación. Entonces voy a platicarles un poquito de cada uno de estos. En la parte asistencial estamos buscando y apostando mucho por el modelo de medicina integrativa, que es aquí donde la doctora Mimi y sus colegas realmente han sido súper importantes para nosotros, para este desarrollo. Entonces, la medicina integrativa, para los que no la conozcan, es un modelo de atención centrado completamente en el paciente, en donde tenemos un equipo multidisciplinario alrededor y cada parte de ese equipo es importante porque al final estamos muy sensibilizados en que las personas no somos únicamente entes físicos, somos entes físicos, emocionales, espirituales y sociales. Y todas estas diferentes variables pueden afectar a nuestro bienestar y pueden afectar a nuestra salud. Si nosotros alguna de estas áreas no las tenemos en balance, al final nos lleva a comportamientos que después pueden ser deleterios para nuestra salud. Entonces, este modelo de medicina integrativa, otra de las características que tiene y por lo cual es diferente a lo que normalmente hacemos en medicina convencional, es que buscamos atacar la raíz de las enfermedades, o sea, realmente atender más que el síntoma y bajar el síntoma, buscar entender y hacernos la pregunta de por qué estamos enfermos, o sea, qué nos llevó a esa enfermedad y buscar estas como detectives, estas diferentes variables físicas, emocionales, espirituales y atenderlas de igual manera todas, ¿no? Y otra cosa muy importante, yo creo que este es el poder del equipo que tenemos aquí, porque debo decir que todas las personas que están en este equipo tienen son buenas personas que están apasionadas con su trabajo y apasionadas con realmente acompañar a las personas y son felices cuando alguien logra, aunque sea el objetivo más pequeño. Pero al final el equipo es un acompañante del paciente. No somos un equipo paternalista que le dice a la persona qué hacer. Realmente respetamos mucho la narrativa de las personas. Cada persona viene de una biografía diferente, de una narrativa diferente, está en un proceso de vida, cada quien diferente. Y entonces tenemos que acompañar al paciente desde donde está y hasta donde quiere llegar. Y respetamos mucho que aunque somos expertos en salud, el paciente es el mayor experto en sí mismo. Entonces, la persona va a saber cuál es la manera para poder empezar ese camino de salud y que no sea nada más un intento de 3 meses y que luego sea fallido, sino realmente un cambio de raíz en su salud. Entonces, todo esto se viene haciendo porque al final en México tenemos pues una ola de enfermedades crónicas que realmente atacan nuestro sistema de salud, cada vez es más costoso, cada vez más fragmentado Y lo que queremos es buscar también a través de la educación, en alianza con la Escuela de Medicina, que más doctores tengan esta visión integral de salud, porque al final la gran mayoría de las enfermedades crónicas, con un buen estilo de vida, o sea, atendiendo realmente el sueño, el descanso, la relajación, el tener buenos alimentos o los mejores alimentos posibles o nutritivos para nuestro cuerpo, el movimiento, es lo que ayuda a que nuestros genes puedan expresarse positivamente o si hay un gen muy, muy difícil, pueda acallarse, ¿no? Entonces, tenemos el poder a través de la información que damos todos los días a nuestro cuerpo de ayudar a que evitemos una enfermedad. Y en la parte de investigación, lo que vamos a estar trabajando mucho es aprovechar este equipo súper robusto que tenemos de investigación básica para poder hacer investigación pues translacional. Al final, parte de lo que hace medicina integrativa es buscar mejorar la función normal del cuerpo. Entonces, el equipo de investigación que tenemos aquí es experto en muchas áreas, en salud mitocondrial, en microbiota intestinal, en otras cosas que cada vez vamos a ir viendo más en la parte clínica, que ahorita todavía sigue siendo muy básica o muy de investigación, pero que al final es muy importante para nosotros poder ser generadores de conocimiento y no nada más transmisores de lo que ya existe. Entonces, pues esos son nuestros compromisos, ya lo dije en fuerte, entonces tenemos que irlo trabajando, pero bueno, ya sin más los dejo con la doctora Mimi. Sí.
No, pues es que déjame nada más darle las gracias. Mimi, Tabata, and Ronnie, I'd like to thank you in advance for having made the trip to come over here. I think it's probably not a short trip, but I hope that the time that you spend here, you get a picture of what we want to do, and I think this may be just the beginning of a relationship where we can introduce many of these new concepts into Latin America. And I think with the strength of the university in Mexico and maybe the connection that we have, we probably can create a synergy that will be useful and will be productive, and we can help a lot of people in that manner. So thank you very much for being here. So I know it takes time and it's difficult, but hopefully we'll do something together that's of great value.
Muy bien, entonces pasamos con la presentación de la doctora Mimi. Vamos a tener una biografía, una pequeña semblanza y ya pasamos con ella.
Dr. Mimi Guarneri is board certified in cardiovascular disease, internal medicine, nuclear cardiology, and integrative holistic medicine. She is a founder and president of the Academy of Integrative Health and Medicine. Dr. Guarneri serves on the founding board of the American Board of Physician Specialties in Integrative Medicine and is a clinical associate professor at the University of California, San Diego. An award-winning physician and researcher, she has been recognized for her national leadership in integrative medicine by the Bravewell Collaborative, and she served as chair of the Bravewell Clinical Network for Integrative Medicine. Dr. Guarneri has been interviewed on many national syndicated television shows, including The Dr. Oz Show, NBC Today, and PBS Full Focus, and To the Contrary. Her work also was featured in a two-part PBS documentary, The New Medicine. She is author of The Heart Speaks, A Cardiologist Reveals the Secret Language of Healing in 2007, and Perils to Awaken Your Healing Potential in 2017. She is co-author of Total Engagement, The Healthcare Practitioner's Guide to Heal Yourself, Your Patients, and Your Practice in 2014. As a professor of the Great Courses series, The Science of Natural Healing, she presents 24 of the 30-minute lectures in video and audio formats. She has published extensively in peer-reviewed journals and is a frequent lecturer at symposia, sponsored by such medical institutions as Scripps Health, Wright State University, University of Alberta, the Heart Institute of Dayton, Meridian Healthcare, Atlantic Healthcare System, and the American College of Physicians. The recipient of numerous awards and the leading proponent of integrative medicine. Dr. Guarneri was ranked by Newsmax Media in 2015 as number 6 out of the top 100 physicians who embrace integrative medicine. Dr. Guarneri was honored as the ARCS Scientist of the Year in 2009. In 2011, she received the Bravewell Leadership Award, which honors a physician leader who has made significant contributions to the transformation of the U.S. healthcare system. In 2012, the Institute for Functional Medicine honored her with the Linus Pauling Functional Medicine Lifetime Achievement Award. And she also received the Grace A. Goldsmith Award from the American College of Nutrition. She helped create and continues to direct several national integrative medicine-based conferences in San Diego that draw thousands of healthcare providers from across the United States and globally. San Diego Magazine's Woman of the Year Awards honored her with Health and Wellness Pioneer 2016 for her significant development of the San Diego region as a leader in integrative medicine. Welcome, Dr. Guarneri.
Good morning. Thank you so much for this warm welcome. I have to see by a show of hands who understands English. Everybody? Good. Oh, that makes me feel so much better. Because my Spanish, I promise the next time, my Spanish will be much better, much, much better. I want to thank Dr. Torre. It's just wonderful to be here. Dr. Maldonado, Dr. Sanchez, and I know Mr. Bose escaped because he has an important meeting, and the entire healthcare team for welcoming us. We really are grateful and so happy we made this trip. I didn't start my career at all thinking about health. I started my career very much like Dr. Torre, sitting in the cardiac catheterization lab, looking at diseased arteries and saphenous vein vessels like this one. And in 1990s, I never asked a question. Why does someone who's had a bypass, which this gentleman had, you can see the wires in the chest. Why, if you've already had a bypass surgery, are you back already with new blockage in your blood vessels? All I knew at the time was we had this box of tools, whether it's a stent or a drill or a suction catheter, atherectomy. My goal was this, to fix that blood vessel. And I never asked a question, if I'm just fixing this little piece, what about all of the blood vessels in the body, right? So everything I talk about for integrative medicine comes out of my focus as a cardiologist. But I think it's important to remember that everything we do for the heart, we do for the brain, we do for the kidney. We have blood vessels from the tips of the toes to the top of our head. So everything we talk about that helps the heart, helps the entire vascular system and the entire human, the entire body. So this, to me, I would put these stents in, and I did do over 700 a year. And I would go and make rounds in the hospital, and my patients would have things like roast beef sandwich or white bread or cream sauce. And I never connected the disconnect between health and this great work that we were doing. So that sent me on a journey to say, how could we be so strong in prevention as we are in intervention, right? We can have both worlds together. And that's been my journey for life. Honestly, that's my life journey. So despite all of the stents that we do, all of the great bypass surgery, the World Health Organization reminds us that 3 in 10 deaths will happen because of cardiovascular disease. It's number one for the world. And 80% of these deaths could be prevented. And that's where Health for Life comes in. That's your work as a team. Because if we can transform the way people think, if we can model a new form of medicine that focuses on health and lifestyle, we can be those. Remember that what the word doctor means is teacher, right? That's what doctor means. Doctor is teacher. And we have to be the model for this new health that we're talking about. Now, I am a big advocate of conventional medicine. I use medication in my practice. Somebody has congestive heart failure. We are gifted with great drugs, Coreg and Entresto and spironolactone, great medications. If someone has a heart attack, you want to be right in Dr. Torrey's cath lab. So I want to keep the good stuff that we do, but I also want to be as strong on the prevention side. And when someone has a health challenge, when someone has the stent, when someone has the bypass, someone has diabetes, how can we transform their health? How can we teach them to eat differently, exercise differently, sleep better, transform the way they respond to stress and tension? So how can we bring both of these worlds together? And I give TecSalud an enormous applause, because at the highest level of everyone I've met here, people are engaged and saying, we need to do this. And that is powerful medicine to me, to hear that. So this is the global burden of disease. It's a lot of things to look at. But what's important to notice, if you look to the right, we now have the diseases, what I call the diseases of excess. Years ago, it was malnutrition. That was number one for children, for example. Now it's diabetes, it's obesity, it's high blood pressure, it's too much salt in the diet. It's all those things that we can transform through educational process. We now know that we have an epidemic of obesity. You just heard about the importance of obesity right here in Mexico, but it's the same all over the world. I just put this in because it's hot off the press from the United States. And I just want to point out children, 10.3 million children. So if we don't teach the parents, how do we impact the children who are growing up to have vascular disease in their 20s? This generation will not live longer than their parents because of these health challenges. And women, 14.7 million. And moms, women, are the caregivers mostly, mainly, still to this day. So we have to embrace all the moms and teach them a new way of thinking. So right with that obesity, you're not surprised that the World Health Organization tells us 10% of the world population has diabetes. So you say, okay, we have obesity, we have diabetes, we have non-alcoholic fatty liver disease, 50% increase by 2030. This is global statistics. And so I came to realize a long time ago, well, I can put the stent in, and that helps the person right now with their chest pain and their shortness of breath. I need to do more to prevent these things which are causing the problem in the first place. High blood pressure, right, affects billions of people. And 1 in 5 are not even being treated. Most people don't feel it. And they say, I don't feel it. Why should I be on medication, right? Again, everything here is completely preventable. I put this map in because I have a huge interest in sleep. And sleep apnea, for example, because it really affects cardiovascular disease. It's a map of the US, granted, but I have a feeling it's going to probably be similar here. If you look down where we have the most obesity in the United States, that southern area, you have people sleeping less than 7 hours a night. Why is it important? Well, if you start to look at the risk factors for sleep, you see people who sleep less tend to be more obese. People who sleep less have to have more heart attacks. They have more diabetes. They have more stroke. And a lot of this is related to sleep apnea. So we start to see all of these things that we can prevent. We can improve insomnia. We can improve blood pressure. We can improve diabetes. We can get people to their ideal weight. But we have to put the investment, time, and energy into that. The same kind of time and energy we put into doing our procedures that we're very fond of. Now, this is something that a lot of people aren't aware of, which is that link between obesity and pain. If you look at pain syndromes across the board, from arthritis to fibromyalgia, it's all linked to inflammation. And as the body weight goes up, the pain goes up. And this is why you see so many people in your clinic when they come in and they say, you see they're overweight, their knees hurt, their back hurts. It's all, most of it is inflammation. And most of it is not going to get fixed with surgery. When you need surgery, you need surgery. But the first step, I always say to my fellows, is let's change the diet. Let's get the weight down. I mean, of course, if someone is paralyzed, they need a surgery if they have a disc or something. But most of the people we see just have what they call their aches and their pains. So if you look at people between 60, 69 years old, the more obesity, the more pain. So this is what the research shows. You know, the foods that we eat, right? I mean, I hate to use this expression because we have such bad things happening in the world right now, but we used to say the weapons of mass destruction are the food we eat, right? This is really what's hurting us, right? And this is something we can change right now, today. We can change it in our cafeterias. We can change it in the selections we make in our home. We can educate our patients. This is a step we can take. And this is really one of the pillars of integrative health. And it's one of the main things I'm sure Dr. Maldonado will be teaching. Now, this is important as well, the environment. I was so happy when we went yesterday to the wellness center, and the first thing I noticed was the recycling bins. You might think that's strange, right? But everything in its place. Compost, paper, metal, plastic, everything in its place. Because if we don't have a healthy planet, we will never have healthy humans. And unfortunately, what the World Health Organization told us in 2017 now, that's 5 years ago, air pollution claims 7 million lives annually. 7 million. And it is now considered an independent risk factor for stroke. So when we do our checklist, when I teach the doctors and we say, okay, is your cholesterol high? Yes. Diabetes? Yes. Obesity? Yes. Now we got to say, what kind of air is this person breathing? Right? What else is going on in the environment that's affecting their health? And this is also rampant in the medical literature right now. The role of toxins, lead, mercury, cadmium, arsenic, linked to mitochondrial dysfunction, linked to diabetes, linked to vascular disease. So again, we have to think about the air we're breathing, the water we're drinking, the soil, right? What are we exposed to? It's as important as the cholesterol level. Now, the reason I believe integrative medicine is so important is because we have to break this cycle. This is how I was trained. I was trained to take every issue a patient has and to give a medication. So if you say, I have arthritis, I say, take Motrin, Aleve, Advil, take a pill, take something. If you say, I have high blood pressure, I say, take this pill. Diabetes, take that pill. I'm depressed because I take all these pills, take another pill, right? So it's this ill to the pill thinking. Now, I also don't like the other way of thinking, which is the sick to the supplement. Or people say, well, I won't take pills, I'll take supplements. We can use whatever works. The point being, let's get to the underlying cause. That's the work of integrative functional medicine, right? Saying, it's one thing I teach my patients when they say, they come in, they say, I have diabetes. I say, okay. They say, I take this medicine. I say, okay. They say, why do you have diabetes? Why? Let's ask why, because if we can figure out why, then we can get to what we can do. So this ill to the pill, polyills, is gotten us into a mess right now. And I can't speak for Mexico, but I can speak for the US. I see people who come and they have a bag of pills and they have a bag of supplements, right? And they're eating the wrong foods. So what's the first thing I say? Let's clean up the diet. Or they say, I'm so stressed, I'm so anxious, I'm so stressed, I have 20 friends in this pack of cigarettes. Well, then I say, we have to deal with your stress. Or I'm so stressed, I have a bottle of wine every night, right? We hear this in our practice. Or I eat this box of donuts because it makes me feel good. Right? It's the same everywhere in the world, I would think. So the new framework for how we think is we can start on the right-hand side and I can say, okay, blood sugar's high, take more metformin, cholesterol's high, I'm going to give you statin therapy, blood pressure's high, I'm going to give you ACE or an ARB. I'm not anti-medication, I'm actually pro-medicine, but my goal is how can we use less medicine and more lifestyle? Or we can go upstream and we can say what's causing the problems in the first place. So I teach it to my patients this way. I say, if you have a tree and the tree has some sick fruit on it, we're going to label the tree. And the patient say, okay, I have depression, I have diabetes, these are all my sick fruit. And say, well, we can give you drugs for all those things, but we also have to look at the soil. We have to understand why. So there's not one condition you can't put on the tree and go to the soil. So if you say diabetes, right? We have a lot of young doctors here. If you say diabetes is the problem, then you say, what is the person eating? What are their macronutrients? How much sugar? How much simple carbohydrates are they eating? Do they have micronutrient deficiencies? We know beyond a shadow of a doubt, magnesium deficiency linked to diabetes, for example. And there's many others. Are they physically active? Are they walking 10,000 steps a day? Are they swimming in the pool? By the way, you have a great pool at the Wellness Center. I really wanted to go in that pool. Are they active? Are they sleeping at night? Right? Because if someone is not sleeping, their cortisol goes up. People with sleep apnea have high cortisol. What does cortisol do to blood sugar? It raises it, right? So anything you can look at, you can go to the soil and say, how can we change it? So we can't think of human beings anymore in silos. I was trained, just like I'm sure Dr. Torrey, same story, we take care of the heart. Somebody's depressed, to the psychiatrist. The joint hurts, to the rheumatologist, right? But it's really all connected because everything you do affects everything. And that's a new way of thinking for us in healthcare. So I'm not going to bore you with this slide because this is one of the slides I use when I talk to the functional medicine docs about cardiology, but it establishes a framework of all the things we have to think about. We have to think about sleep. We have to think about movement. We have to think about nutrition, macronutrients, about stress, right? Now, everyone in this room knows if you're under stress, what happens to your heart rate? What do you notice? Goes up. What do you think happens to your blood pressure? Goes up. What do you think happens to the coronary arteries? They constrict. What happens to the platelets? They get sticky. So why, as a cardiologist, do I care? Because it affects the heart, affects the entire body and our relationships, right? Are we in a good relationship? Do we have friends? Do we have confidants? All of these things are what we call the pillars of health. So when you see an integrative functional medicine trained clinician, a health coach, they're thinking about all of these things, right? Is this person, are they happy? Do they have a purpose in life, right? This is what makes us human. I want you to focus a minute on this concept of inflammation because obesity leads to inflammation and what we say oxidative stress. This combination leads to vascular disease. We know from cardiology that every step along the way of vascular formation and plaque formation is related to inflammation. We know that it's a teeter-totter between the good stuff, nitric oxide, and the not so good stuff, angiotensin II. So when I trained eye doctors, I say, everything we can do to decrease inflammation, to decrease oxidative stress is going to improve the well-being of the individual. And that means looking at all of the things that go into that. sleep, stress, food, micronutrients, physical activity, the stuff that integrative medicine is really good at. I don't know how it is in Mexico, but in the US, we forgot about the physical exam, right? Today, the young doctors say to me, 65-year-old, the test shows. I said, well, wait a minute. Before you go to the test, talk to me about the person. Who is this individual? What's going on in their life, right? Let's talk about the physical exam. So I put this here as reminders, right? That there are things when you see an integrative physician that we're thinking about. I mean, we're looking for the obvious things like an ARCUS for cholesterol, but we're also looking at somebody who's got premature gray hair, and we're wondering about nutrient deficiencies. We're wondering about oxidative stress. We're wondering about cholesterol when we see this. We're wondering about diabetes when we see this. The body, the point of this, the body gives us lots of hints of what we should be looking for. In our exam rooms, it's not enough anymore to just say, let me do blood pressure, pulse, right? We do blood pressure, we do pulse, we do respiratory rate. I'm going to say now we have to do the fourth vital sign, which is the waist circumference. Is someone carrying that extra visceral adipose tissue? Why? Because now you know that's somebody who's got inflammation. Oh, and by the way, that inflammation leads to heart disease. That inflammation in the fat, in the obesity, central obesity, produces all sorts of inflammatory cytokines, right? Which make people sick. So even if someone comes to your office and they look thin, they could be thin fat, right? They can be thin, but they don't have muscle. They're all fat. And we see this a lot. I hate to say it in women. Women say, I'm going to lose weight. So they don't eat, but they also don't exercise. So they lose their muscle. The scale looks better, but when you do a body composition, you say, oh, no, you're skinny fat. Now you're skinny fat. You're not actually any healthier, which is why we recommend doing things like body composition. Like this man, you would say, oh, he's got a high BMI. That's your height and your weight. And yet you look at him and you say, wow, he's in great shape. So what? His BMI is high because it's all muscle. So this is just a reminder not to be fooled that we have to be a little bit more creative when we're looking at our patients and do things like body composition. But you can do this right in the office, right? You can do a waist to hip ratio. And this simple waist to hip ratio has been validated and will tell you who's at risk for vascular disease. So I just want to go to that fourth vital sign of paying attention to what's going on in the midline. So what do we know in cardiology about this inflammation? Years ago, we only talked about cholesterol. And then a study came out called Prove It. And we said, what's going on in this study? People with the same cholesterol level, one has more risk than the other. What else is happening? And we realized it was the people with lots of inflammation, higher CRPs, that were the ones that were getting into trouble. So again, this concept is very important. That's just another illustration of it. For years, we talked about the cholesterol being LDL being the bad cholesterol. One of my patients calls it the L is lousy cholesterol. They say the HDL is happy cholesterol. And I said, well, it's not always that easy because people that have that extra weight in the midline modify their LDL, and that makes it much more aggressive. So not to bore everyone with this kind of stuff, but it's important to recognize that when you eat the sticky buns, right? When you eat the white stuff, when you, as you'll see in a minute, when you have gingivitis in your mouth, when you have untreated infections, when you have heavy metals, you end up churning on all these inflammatory cytokines that lead to vascular disease. At the same time, when you change how you eat, when you start moving, when you get a good night's sleep, when you start transforming your response to stress and tension, you can turn this whole process around. And for those of you that think about lipids, which I do all day long, unfortunately, it's not good enough anymore to just look at LDL. We have to look at particle numbers. The heavier someone is, the more midline weight they have, the higher the particle numbers. And if they can get that weight down, you can improve their lipid profile. And for some people, this is the difference between adding a higher dose of medicine or an extra medicine and so on. So other markers we look at for inflammation, LPP, LA2, and then we look to see, is the good cholesterol functional or is it not functional? So again, these are all important things, and it all begins with lifestyle. That's my point here, right? So if we look at lifestyle, we say, is the inflammation affecting the function of the good cholesterol to pull plaque out of the vessel? Lifestyle modifies all of this. And that's why this health for life is so important. It is critical that we can start to turn the trend around of what we're seeing. So I'm not going to go through the markers. This is for you, Dr. Torrey. We're doing some new blood tests, which are kind of interesting for inflammation and very interesting, I think, for restenosis in arteries. So I'd love to, that's my reminder that we're going to talk about that. Remember to look in the mouth. Remember we said a source of inflammation is heavy metals. These are Burton's lines, people that have high levels of bismuth, of mercury. Who looks in their patient's mouth here? You got to take the face mask off. You got to look in there. Plus, you can also see who has a big tongue, right? Who has a big uvula in the back. That's a clue they might have sleep apnea leading to their inflammation. So when that person says, oh, I wake up in the middle of the night to urinate, they're not really waking up to urinate. They're waking up because they have apnea. Then when they get up, they say, oh, I have to urinate. So lots of clues in the mouth. When you see teeth like this, get a dentist, because all this inflammation, right, leads to cardiovascular disease. And a beautiful study came out of Finland, which showed that people having heart attacks, when they analyzed the blood clots from the heart attack tissue, when they took a sample out of the artery and they analyzed it, they found it was filled with dental pathogens, right? Something we never think about. So again, I put it here to think about. I put this here to think about too, because in my practice and my students, they say, oh, your blood pressure is 130. That's not too bad. I say, that's not a normal blood pressure. Should be 120/80, right? Again, inflammation will raise that. And then I say to my patients, for every pound of weight you lose, you'll decrease your blood pressure a millimeter of mercury. So 10 pounds of weight loss, that's 10 points on your blood pressure. Powerful medicine. Right? We have great tools and technology. You have it all here, right in Monterrey, to detect heart disease early, calcium in vessels, for example, looking at plaque in the arteries of the neck. Lots of things we can do, blood flow to the heart. We can even do angiograms now through an IV in the arm. There's no reason, really, that we can't detect disease early and put a program in place that's going to prevent someone from having that first event. So I like to think of lifestyle as an intervention. It's cost effective and it's life-saving. Right? And that's the goal of integrative holistic medicine. It's great to know all this stuff, and I love being a cardiologist, but when my patients come in and say to me, hey, I lost 25 pounds. My back pain is gone. I cannot tell you all the symptoms that go away when you change people's lifestyle, right? So I think about it this way. Lifestyle and environment accounts for 70 to 90% of the disease we see. Your genes are just at the top. Yes, if you have Huntington's chorea, that's a genetic issue, right? But people that come in and say, oh, my father died of heart disease, passed the bacon and eggs, I'm going to die of heart disease. I said, no, it doesn't work like that. We can change. Your genes are not your destiny, right? This is a perfect example. This is the Amish study from the Archives of Internal Medicine. The researchers realized that this group of Amish have the obesity gene. And somebody was smart enough to say, they don't look obese. And they went in and they studied the community, and they found that they walk 17,000 steps a day, right? A perfect example of how your genes are not your destiny. This is some research we did in the 90s, the Lifestyle Change Program with Dean Ornish, where we said, let's take these really sick heart patients. These were people we couldn't stent. They weren't candidates for bypass. And we said, let's make them vegetarian. Let's get them walking. Let's teach them yoga and meditation. And let's put them in support group. Let's see what happens to these people. So these were some of our patients walking on the track. You have a great track over at the New Fitness Center. We taught people how to eat. This was critically important. How to substitute. Instead of picking, the white bread, get a whole grain if you're going to have a bread. Get an extra dose of vegetables instead of an extra dose of something white like pasta, right? Teaching people how to cook was fundamentally important. Teaching people to get in touch with what was important in their life, right? Doing their forgiveness work, letting go of their anger, learning to transform how they respond to stress and tension. And what did we find? I was shocked when I looked at these images because, again, as a cardiologist, I said, I don't know about all this. This was the 90s. But if you look on the left, I think I can convince you the blood flow to the heart on the left, where it's all black, is improved 1 year later, and the artery looks better, right? So I looked at this and I said, well, why not have all the best of the medications, all the best that we can do, and put the lifestyle together? And that's really where I began to embrace integrative health and medicine. I said, I'm not going to throw out what we're good at in the cath lab if someone needs a procedure or a surgery, but how do I bring this other piece in? And now in the United States, this is covered because of the research we did for people with heart disease. This program's actually a covered Medicare benefit. And what did we learn? We learned that the more people did, the more benefit they got, meaning the more reversal in plaque. So Dr. Ornish then took this research and said, let's apply the same concepts: yoga, meditation, diet, exercise, group support to men with Gleason 6 prostate cancer. If you look to the left, all the red are cancer genes that are turned on. After 1 year of program, 500 cancer genes are downregulated through lifestyle change. Just let that sit in for a second. 500 genes downregulated through lifestyle change. And that's what we're talking about at Health for Life, is how do we bring these together? This was a beautiful study that looked at people with genes for cardiovascular disease, high risk, and they found if you just lived a healthy lifestyle, gave up your cigarettes, ate an anti-inflammatory diet, walked, got rid of your anger, right, that the genes really didn't matter, right? Your lifestyle trumps your genes. So this is the challenge we have. Most doctors, myself included in the 90s, feel more comfortable prescribing drugs than talking about food, right? When I came out of medical school, I could not teach a patient how to eat. I could know chemically what a carbohydrate looked like, but if you gave me a plate of food and said, pick out the simple carb, pick out the complex carb, what are the good fats, prepare a plate, no way, right? And that's part of the issue. And this is why we need specialists and everybody trained to understand how to do this. Because the reality is, the whole concept of food is medicine, what Hippocrates said, has been forgotten about, right? So let me just run you through a few of these. This was where it all started. This is the Lyon heart study, where they took people with coronary disease and they said, okay, let's get you to eat a low glycemic, anti-inflammatory Mediterranean diet, lots of beans, lots of legumes, lentils, fish, and they had a 72% reduction in cardiovascular events. The HALE study, same thing. So we're not talking about fake journals. We're not talking about alternative medicine, right? We're talking about major research on mortality showing reductions in cancer and cardiovascular disease published in the Journal of the American Medical Association using diet and lifestyle. PREDIMED, 2013, 30% reduction in cardiovascular events, right? Food is medicine. And it's very important to even recognize that when we look at all of the evidence, we talk in cardiology about level C evidence. Most of our evidence is level C. Level A is the best evidence. Mediterranean diet gets level A evidence for cardiovascular disease, right? So we should be teaching people how to eat. For all those people that think beef and pork is good for you, I always love to show this study, which came out in 2016, which compared beans and lentils and legumes to animal products. And guess what? The beans, the lentils, and the legumes had lower mortality. What about pain? We know that lower back pain is linked to high levels of that protein I mentioned earlier, C-reactive protein, right? But we also know if you change the way people eat, all that inflammation comes down, back pain goes away. 5% weight loss, 30% reduction in pain, 24% improvement in function. We are giving people all sorts of drugs when medicine could be their food, right? Food could be their medicine. Magnesium deficiency linked to migraine headaches. Low magnesium, increased inflammation, marked reduction in headaches, correcting magnesium deficiency. Magnesium also linked to diabetes and to inflammation. I can give lectures on nutrients and nutraceuticals, evidence-based. And that's the beauty of integrative medicine. We train the evidence so that people know what to use and when to use it. So somebody comes to me with migraine, they're getting magnesium, and I'm measuring their intracellular magnesium, right? So let's just talk briefly about stress, because you're very fortunate here to have a team that really understands the power of mindfulness, understands that transforming the stress response is critically important to health. Has anyone here ever seen an angry person? Right? What do you think? You say, oh, he's a hothead. Oh, he's blowing a fuse or a gasket, right? What do you think's going on in the vascular system, right? Blood pressure's up, heart rate is up, coronaries are constricting. This is all stress related. And it's all about, in our life, our perception, how we see things. Right? If the stock market goes down, somebody might say, ooh, I'm going to buy more stock. Somebody else might say, oh my God, that's terrible. It's doom, right? People's response to things, really what is important. But there are a couple of hormones that are really intimately connected to this: adrenaline, noradrenaline, aldosterone, cortisol. Every doctor in this audience knows if you give steroids to someone, what are you worried about? What do you think? What do you say? I have to monitor their blood sugar. I have to watch their bones for osteoporosis, right? We all know this, yet we don't think to link the cortisol that the body's producing to these diseases as well. So in the 90s, as a cardiologist, I started to think about, what about the drugs I'm giving, right? How are they impacting the stress response? And I realized a lot of the drugs I was giving, the aspirin, and in that day, a drug called Tyclid, now it's Effient, affects coagulation. Well, stress makes platelets sticky. I was giving medications for blood pressure, giving metformin for insulin resistance. Stress is linked to high cholesterol. The data is there. You increase the stress. It's been studied in Navy SEALs and so on. As stress goes up, cholesterol goes up, blood pressure goes up, arrhythmia goes up. So I thought, wow, a lot of the drugs I'm giving are impacting the stress response. And so if I put that all together, someone's emotional state, are they depressed? Are they smoking cigarettes? Are they under stress? the end result is all the things I see in my clinical practice. So now we're going to think about aging. You know, look at President Obama. Everybody knows Obama, right? He had nice black hair coming in. What color was his hair when he went out? It was white. It was like right in front of our eyes. We were watching the impact of oxidative stress. And you say, what does stress do? It accelerates aging. It's everything we associate with aging, right? Your bones get brittle, you have osteoporosis, that's cortisol. You put weight on in your midline, that's cortisol. Your blood sugar goes up, that's cortisol. We say, oh, these people are getting old, but we see the same thing with stress, right? So I'm not going to read these to you. It's just all the links between stress and vascular disease, and they're huge. As a matter of fact, I took out a bunch of slides, but there's, you know, stress raises homocysteine, raises cholesterol, and so on. So the list is pretty endless. So again, as a cardiologist, I want that mindfulness class. I want a place where I can send my patients to transform how they respond to stress and tension. And this is what else we know that's really important. There's an epidemic right now of depression. And depression is strongly linked to inflammation. So if you have something going on in your gut, if your microbiome is off, if you have food sensitivities, if you're eating too many Cinnabons and you have inflammation, that inflammation causes something called cytokine sickness, which causes depression. This is why when you change people's diet, their depression often improves, right? So it's the link between the gut and the brain. And it's a very clear link that we're starting to understand more and more of in medicine. This researcher, Dr. Blackburn, who got the Nobel Prize, did some amazing research looking at telomeres and telomerase, the enzyme of longevity. And her research is phenomenal to me because she looked at the impact of stress on telomere length. The longer your telomeres, the longer you're going to live. The more telomerase you have, the more repair you have of your telomeres. What she found was that if you take pregnant women under stress, right, the babies are born with shorter telomeres. Now, she won the Nobel Prize for her work. So that's why we have to take good care of pregnant moms, right? Because the children right away are impacted. And it's not only at birth, but that impact persists until their teenage years unless something changes. She also studied racial bias. People who feel they are being racially judged. And what she found was those people who've experienced a lot of racial bias have shorter telomeres. Again, stress and links, of course, to cancer and cancer mortality. So what did she do? She said, and you're going to have a mindfulness session later, she said, let's teach people mindfulness-based stress reduction. And let's see, after a week of intensive training, if we can impact these telomeres. And that's exactly what happened. The telomerase enzyme went up after learning to meditate. Dr. Schneider took African Americans with very high blood pressure and said, let's teach them transcendental meditation. 48% reduction in heart attack, stroke, and sudden death. 48% reduction. This is why the whole mind-body piece is critically important. If you get vaccinated and you're under stress, and this is, many studies have shown this, they use medical students usually as the guinea pigs for this. They vaccinate during vacation or vaccinate during exam week. Antibodies under stress are not mounted. Right? Less of an antibody response to the vaccine when under stress versus being trained and with meditation. And in this study, it was mindfulness. This is an anxiety study using mindfulness, showing anxiety levels significantly dropping post-treatment. Right? So this to me is medicine. This to me is as important as my Coreg and my Entresto and my metformin, right? How do I bring those two worlds together? That's what Healthful Life is going to be doing. I hope, and I'm sure it will. When I started this work in the 90s, there was no data on meditation. Look at it in the 90s, nothing. And now the research has taken off, so much so that even our children today, they talk about meditation, they talk about yoga. When I grew up, we didn't know what any of that was. And if we heard it, we thought, oh, that's some weird stuff. That's not us. This is the journal of the American Medical Association, Meditation, Improvement in Anxiety, Depression, Pain, and Quality of Life, right? So treat the whole person, holistic model, body, mind, emotions, and spirit. Put the stent in if you need it, but do all these other pieces to prevent it. I think Florence Nightingale put it beautifully. She said, the needs of the spirit are as crucial to health as the individual organs which make up the body, right? Spirituality, what you're connected to, what gives you a sense of strength. You should know that. We should all know that for all of our patients. Where do our patients go in time of stress? The research shows that 90% of people believe in a higher being. Don't be afraid to ask your patients, what's your belief system? Because when they get into trouble, you need to know that belief system so you can help them to gain strength from it, right? So I think that, and there's a whole realm of spirituality research, but I really think when you believe in a higher power, when you believe in the divine, when you believe that things happen for a reason, whatever your belief system is, it doesn't mean you give up, right? But it helps you to surrender almost to the process and to be able to move on. And I think that's powerful medicine. So understanding that. It says, hey, is that great traffic or what, right? So there are things we can't control in this life. So I think we're at a tipping point, and the tipping point is here. And TecSalud is going to lead the way, not only for Mexico, but TecSalud is going to lead the way for Latin America. And I really believe that. There's no doubt in my mind. I think all the right people are having the discussions. So this is the roadmap for health. We really think and believe at the Academy that health needs to be part of the community, that we need early intervention and prevention, that we need to look at not just a cholesterol level as our scorecard, but how are people doing? How is someone doing in their life, right? How do we partner with our patients, right? How do we partner for health? And how do we go from a sick society to society that really focuses on health and well-being? How do we go from just procedures to creating more health? I like to see the best of intervention, the best of prevention, right? How do we bring this into our culture, not just in a hospital, but out there in the world? And I think that TecSalud has that as a vision and a mission, is to create healthy communities. And that to me is going to be everything. Create healing environments, not just physical buildings, but spaces where healers can do their work, where they can connect with people in a meaningful way, and where people can come together to transform their health. Now, the World Health Organization is in agreement with us, which is great. The World Health Organization is saying we need to implement strategies that bring back traditional healing principles. The sustainable goals of the UN, if you take a look at number 3, good health and well-being, we're right there. We're right at that tipping point. Everyone is talking about it. In the US, integrative medicine has been made a board specialty, right? You have to take an exam now as a physician to call yourself an integrative health and medicine doctor. So that to us was a big step, because we said if we don't have it recognized, like cardiology, right? We're never going to be able to move forward. Our whole goal at the Academy of Integrative Health and Medicine has been to transform the way clinicians nurses, doctors, pharmacists, nurse midwives, everybody in it together, how we learn together, how we learn from each other, and how we transform our approach to patients. And that's what we're hoping to work with TecSalud here. So in conclusion, I just want to say, Western conventional medicine, the best in the acute setting. You have that heart attack, you better be in that cath lab, right? But we know at the same time, we have global rising levels of diseases that are preventable. Diabetes, obesity, high blood pressure, high cholesterol, sleep disorders, and the list goes on. And we know we need new models of prevention. And the research is giving us a roadmap of what works, what doesn't work, how we should be thinking. And we need health practitioners trained in this approach. When I went to medical school, I don't know how it is here at TecSalud, someone can tell me, I learned no nutrition. I learned no mind-body medicine. I didn't know that my depressed patients were more likely to die because they were less likely to take care of themselves, right? And they had more inflammatory issues. I didn't know any of these things. We know a lot now, and we're learning every day. So we're pleased to be here, Rowney, Dr. Parker, myself, and to partner with this great group, and really to congratulate you on what, to me, is a huge step forward in transforming the health of all of Latin America. So thank you for your attention. Thank you.
Thank you, Dr. Mimi. We have time for questions. Preguntas, si alguien tiene alguna. No? Well, I have a question.
Yes.
Gonna ask a question. Es que está transmitiendo. Okay. So I'm very glad you're here with
Thank
us.
you.
Thank you for coming. Thank you for making the trip. I missed meeting you in your clinic
Yeah.
back last year with Pepe, our good friend and
Yes.
board member, and unfortunately he couldn't be here.
And I'm glad you're saying that, because I just want to interrupt for 1 second to thank Mr. Jose Copel, because he really brought us together. He's really the one who came to me and said, I see what you're doing, and I think TecSalud is heading in that direction. So we owe him a big round of applause, for sure.
Absolutely,
Thank you.
yes. I just saw him. We just saw him last week. We had a board meeting of the university, and I asked him if he was going to stay, but he couldn't.
Yeah.
But he did tell me to say hello, but anyway, I wanted to ask you a lot of good information. I think this is really good that a lot more research needs to be done, so that people who need research-based conclusions to begin to believe, because it's very difficult when you don't have the scientific information. And I wanted to ask you, in terms of the studies, what you have found in terms of supplements, because I've been talking and changing my lifestyle and doing things to understand how lifestyle improves health for a long time, just from personal experiences and personal reasons. But I do have friends that tell me, well, yeah, but if you don't want to exercise or you don't want to eat well, etc., you can complement with supplements, and sort of those take the place of the good habits. And I wanted to get your opinion on that.
Yeah, that's a great question. For those that are interested, Rowney and I are, Dr. Benactor, direct the largest natural supplements and evidence-based approach conference in the United States every year. We'll be doing it again in January, and we've been doing that for the last 15 years. Just like I don't like the ill to the pill, I don't like the sick to the supplement, right? This is my approach to supplements. I do blood work on people to look at their what we call nutrient levels. I want to understand where someone's antioxidants are, their B vitamins, their minerals. So when I think of supplements, I think replete what people need, teach them to eat to replete what they need. And if they have a real deficiency of something, then you may want to augment that with a supplement. That's one approach. The second approach I use is supplements therapeutically. So when someone says to me, I'm not going to take that cholesterol lowering medicine. I don't want to take that statin. And I have people who are like that. I'll say, okay, we have research that shows 2,400 milligrams of red yeast rice, for example, is equivalent to about 40 milligrams of Zocor, which is a prescription pharmaceutical. So that may be a path for that individual. Or if somebody has high triglycerides, low good cholesterol, I may say, we're going to use niacin to lower the triglycerides and raise the good cholesterol. So if I'm using something therapeutically, like repleting the vitamin D, or if somebody has osteoporosis, I'm going to be giving them boron and algae cal and vitamin D and so on. I'm looking at the impact I have with these supplements, right? I'm not just throwing supplements and saying, take everything. There is no supplement that's going to get you feeling good, for having a jump in your step, keeping your weight down. It's not magic, right? We all have to put some work in. We have to stay active. We have to make food choices every day, right? There's no substitute for that. So yes, I have people who take 50 supplements a day. Too much. And when they say to me, I take all these supplements, I don't want to take them all. I say, okay, let's see what you really need. And then I say, you don't need this one. You know what they say? Oh no, I have to have that one, you know? So my approach is replete what's missing. And if you're using supplements to treat something therapeutically, then you'll use it in that way. You know, it's like arthritis. If somebody has joint inflammation, first thing I'm going to say is clean out the diet, off the sugar, off the white stuff. Let's look for food sensitivities. Is it dairy? Is it gluten? I'm going to give them maybe anti-inflammatories, but I'm using them with a purpose in mind, right? And so that's my approach. Yeah.
Hi, Mimi. I'm so glad you're here.
Thank you.
Thank you for being here. I have a question. Can you talk about about the responsibility of the patient, please? Because I think we need to know.
Yeah, I think it's, you know, our role is to teach, and our role is to motivate and to figure out why is it that someone may want to make a lifestyle change. We were talking about this yesterday. I may look at the blood test and say, oh, you have a high cholesterol, you have diabetes, and I don't feel so bad, you know. So what are people looking for in their life? What is their goal? And what you find when you talk to people, I don't do history of present illness anymore in my practice. I do, what are your core concerns? And then people say things like, I want to be able to walk with my grandkids. I want to be able to go on vacation. I want to make it, like one man said, I want to make it to my daughter's wedding, right? I want to be healthy enough to enjoy that. So I think you have to find that anchor and take people, some people you have to make small steps. And the first that's where the health coaching comes in too, right? The first small step may be, let's substitute, you know, white bread for whole grain bread. Let's substitute this pasta for green vegetables. Or if you're going to have a bowl of pasta, I tell my patients, add a lot more vegetables to it. You have to make simple. Instead of having soda, can we get you from alcohols? Perfect example. I can't tell my patients, don't drink any alcohol. It's all sugar. It causes sleep disturbance, raises your triglycerides. I can't say that. They don't want to hear it. So I say, let's decrease the alcohol 50%. Oh, okay, I could do 50%. Let's go half, right? So people have to start to be educated about how they can feel, right? What do you think would happen if you didn't have that joint pain? Oh, I'd be able to walk more. I'd be able to do more. It'd be, you know, so that's the whole purpose of motivational interviewing, right? But small steps for people and group. I cannot emphasize, we did all the work in groups with our heart patients. And when the group comes together, it's like 20 new friends. I have 20 new friends now, and we're all in this together. We're all going to learn how to eat together. We're going to exercise together. We're going to walk the track together. It is transformative, much more so than the one-on-one with the doctor in the office, because every time the group comes together, the patients learn from each other. And this happened at Saddleback Church. I don't know if anyone's familiar with this research, right? The Daniels plan, where the minister there was baptizing people, and he realized he couldn't bend in to baptize, and they were so heavy, he couldn't get them out of the water. And he thought, this is true. He said, we have to do something here. And so, of course, he's a minister, and he said, the body is my temple. My body is my temple. So he took that one quote, that one mantra, if you might. Everybody in the church got on board. He brought in a couple of doctors that we know to teach people how to eat and walking every day and so on. And then the patients became the teachers. They started to teach each other. And I think they lost what? 500 pounds of weight in 6 months, or some crazy number. Peer support, peer-led program. 250,000 pounds, right? Like the first couple of months was like 500 pounds, something crazy like that. 250,000 pounds. Yeah, yeah. I mean, and it happened quickly. So you think about it, and that's not going into the doctor's office. That's my body is my temple. I'm going to own that. So you have to find that sweet spot for people. Maybe that could be our thing here. Yeah, the right motivation.
Hi, Mimi.
Yeah.
How fast or how much has this translated into medical schools?
Yeah.
And in fact, in here, how much do Health for Life will go into medical school? No, but it's in America.
Yeah, so in America, and you can speak, Tanya can speak here, in America, what we hear all the time is, well, we have a set curriculum, and we have to learn all these things, and you have to learn it all in 2 years, and there's really not a lot of room for this. Now, there are tracks within residency programs where people can do an integrative medicine track. But I think the real sauce is to teach doctors from day one this information. And because when you think about it, I spend so many hours learning things I never used in my practice. I used to draw, we had to draw the mesenchyme and all the steps to embryos, and it's all great. And we learned about every parasite in the world, most of which we never see, and all the pathways of tapeworms and things like that. I think maybe we could use a little bit more on nutrition and mind-body medicine and learning to talk to our patients, which they're getting better at that. The motivational interviewing, they're bringing more of that. So I'll let you. No. We have many medical schools that are part of what's called the academic consortium, but actually changing medical curriculum, that's a challenge. You may speak to Mexico and how it is here, I don't know.
One of the main strategies that we have is that we want to make sure that the School of Medicine gets on board with this, with all this strategy, so that education is one of the most important pillars for us. We'll see about that.
Yeah.
So thank you. If we
Thank
can give
you
one
all.
last round.
Thank you so much, and thank you for your great work. Thank you.
Bueno, ya nuestro siguiente. Ay, perdón, un segundito.
Horas.
Perdón, sí.
Y horas. No.
Voy.
No tenemos break.
No. Bueno,
I was asking for a break.
Nuestro
pero
siguiente
no
invitado es Horacio Marchand. Él es doctor en psicología profunda y estudios mitológicos por Pacifica Pacifica Graduate Institute of Santa Barbara en California, máster en administración con enfoque en mercadotecnia por la University of Texas en Austin y licenciado en administración de empresas por el Tecnológico de Monterrey. Actualmente es fundador de Marchand y Asociados, empresa consultora en estrategia, marketing y ventas, enfocado en ayudar a organizaciones a crecer. Entre sus clientes destacan Oxxo, Heineken, PepsiCo, De Acero, Cafenio, Cuprum, Productos Pensilvania, Cemex, entre otros. Forma parte de los consejos y comités ejecutivos de diversas instituciones y empresas y ha escrito más de 1,500 artículos sobre estrategia, ventas y marketing para el Grupo Reforma. Publicó el libro Hypermarketing y el próximo mes lanzará su nuevo libro El Poder Personal. Participa activamente como ponente e instructor en Estados Unidos, Perú, Colombia, Chile y España. Nos va a dar un mensaje, un power talk, sobre todo desde el punto de vista del usuario y también pues de la importancia de esta innovación que estamos haciendo.
Muchas gracias. Bueno, pues buenas tardes, no, buenos días todavía. Gracias que me invitan. Gusto saludarlos. ¿Qué estoy haciendo aquí? Pues es una pregunta, doctora Guarneri, thank you very much. It was very engaging, very interesting. I'm sorry I'm going to speak Spanish. Yeah, thank you. Okay. Bueno, pues van a decir que están haciendo aquí este hombre que no es médico. Lo mismo me pregunto yo y agradezco mucho la invitación. ¿Ok? Quiero abonarles un poco sobre por qué considero que este es un fenómeno mundial. Esto está insertado dentro de una nueva forma de pensar. Y puse el chamán como una intro, porque gracias al chamán estamos aquí vivitos y coleando. Este hombre, en algunas culturas, esta mujer, se aventó a lo desconocido, se aventó a integrar la naturaleza, el sol, el animismo, el panteísmo, y dijo, yo te curo, los dioses te curan. Y el efecto placebo, de alguna manera, se acomodó. Entonces, pareciera, y voy a decir esto en inglés, I have no doubt this is a feminine movement. Just look around. We have too much yang in the world. We need more yin. Y aquí está el ejemplo, ¿verdad? Entonces, las pioneras, aquí vinieron los señores acarreados, me imagino. Memo, Tomás, gusto verlos. Pero vamos a conectarnos. Entonces, el Zeitgeist, que es una palabra alemana, representa el espíritu de los tiempos. En medicina, yo soy consultor de negocios, llevo como 40 años de consultor, me toca ver empresas a punto de morir, a punto de quebrar, con problemas de crecimiento, con problemas de gestión, y pareciera que a veces me siento como un doctor de empresas, y a veces un psicólogo, y a veces un filósofo. ¿Cómo le ayudo a esta empresa realmente a salir? Entonces, ¿cuál es el problema? Somos una sociedad invertida en síntomas, donde privilegiamos lo urgente sobre lo importante, donde trabajamos y nos movemos, ahorita que hablaban de motivación, Ale, nos movemos en base a la crisis, cuando ya no nos queda otra. Ahí es cuando cambian las personas, no cuando de manera preventiva estamos considerando que estamos construyendo algo. Los chinos tienen una frase muy bella que dice que las crisis se atacan cuando están chiquitas, no cuando están grandes. Entonces, el especialismo nos hace ciego y realmente es una afrenta contra los especialistas. Yo digo que los especialistas, si no están conectados al enfoque sistémico, pueden ser peligrosos. Y lo digo en negocios, lo digo en entidades y me atrevo a decirle como paciente en medicina. ¿Para qué les cuento? Y todos aquí son médicos, conocen el término iatrogenia. La iatrogenia también aplica a consultores de empresas, también aplica a presidentes del país, también aplica a líderes mundiales. La iatrogenia es, si no le entiendes a algo, mejor no intervengas. Entonces, tenemos que voltear a ver cómo estamos insertados en un sistema que de manera automática nos lleva a pensar bajo estos términos de corregir síntomas y ser especialistas. Pareciera que si no somos especialistas, no vamos a ganar dinero. Una máxima de teoría de sistemas: las intervenciones sin diagnósticos precisos, sin una definición clara y relevante del problema, acaban generando mayores problemas que los que pretenden arreglar. La intervención de Vietnam, rusos, franceses, norteamericanos, Afganistán, ni para qué se diga, Irak, y podemos pensar en Putin, o Putin, como le quieran decir, podemos pensar en Putin, que pareciera que no entendió el sistema complejo que estaba enfrentando. Entonces, si no lo entiendes, a veces es mejor no hacer nada. Tengo un ejemplo de empresas, ¿ok? Yo soy una empresa chiquita, me toca competir con McKinsey, con Bain, con el Boston Consulting Group, y obviamente no tengo la marca de ellos, pero un día llego con una empresa gigante aquí en Monterrey y traen un problema de entregas sin cumplimientos. Me voy a mover ahora a una entidad de negocios. La solución, dice una de estas consultoras, que yo quisiera ser una de ellas, dice: prioriza a tus clientes. Primero unos, y vamos a ver quiénes son los más importantes, quiénes te dan más dinero, y la empresa dice: ah, no, vamos a implementarlo. Solución mal diagnosticada. Ya están todos los problemas que ocurrieron después como de 1 año y medio. Me toca llegar a esa empresa por otro problema y le digo: ¿traes un desmadre aquí? ¿Qué pasó? Ah, no, es que estamos priorizando a las empresas buenas. ¿Sabes qué? Estás ganando menos dinero que hace 1 año y medio. La solución, entre comillas, con alguien que les cobraba $1,500 la hora, realmente los estaba llevando al fracaso. Oye, Horacio, ¿y tú nunca te equivocas? Pues yo digo que no, cada vez menos, pero definitivamente que tengo mucho cuidado, porque la autoridad que tiene un médico, la autoridad que tiene una persona frente a otro, es muy fuerte. Hay mucha responsabilidad, y más en salud. Entonces, ¿qué pasa? El efecto mariposa en una organización, en un cuerpo, en un sistema, ya sea una persona, una organización, una ONG, un país, el mundo completo, le mueves tantito aquí en las juntas, encerrado, o en base a un estudio, una radiografía o un examen, le mueves tantito y se desbarata el resto del sistema. Entonces, esto que están abordando, esto que están abriendo en TecSalud, bajo mi perspectiva y desde mi trinchera, es game changing por completo. Yo tengo muchos, a lo mejor me corren, tengo muchos issues con los médicos especialistas. Y tú lo sabes, Tania. Hago corajes a cada rato porque siento, en mi opinión, que no están viendo el sistema, pero ya me hice paciente de Tania. Y Tania lo primero que me preguntó es: ¿cómo está tu dieta? Fue lo primero que me preguntó. ¿De dónde viene esto? ¿Por qué estamos insertados aquí? ¿Por qué somos especialistas? ¿Por qué curamos el síntoma y no la causa? ¿Por qué nos gusta medicar o por qué buscamos en empresas soluciones centradas en causa y efecto? Bueno, porque el imperio de lo racional de Descartes nos dice que somos mecánicos, que el mundo es mecánico, como el mundo, como un reloj. Lo segundo, las economías de escala. Este micrófono, yo no sé cómo se hace, pero lo estoy usando. La silla, alguien la fabrica. Esto también, estamos realmente especializados. División del trabajo. Gracias a la producción en serie, tenemos estos avances, pero todo tiene su dark side, ¿ok? El tercer punto es la administración científica y la división del trabajo y las ventajas comparativas del economista David Ricardo. El mundo entonces vira hacia la especialización, la ventaja competitiva y la fracción. Se acaba el holos, se acaba el gestalt, ya no hay. Aquí se junta Fayol Taylor con Henry Ford y este es el mantra de la productividad. Entonces todo el mundo ve una parte en la expectativa de que se haga el entero. Y entonces, si llega un directivo que es ingeniero, lo primero que va a ver en una empresa es la eficiencia. Si llega un directivo que es mercadólogo, va a buscar market share. Si llega un químico, quiere innovación de productos. Lo mismo está pasando. Si hay un líder de un país bélico, va a buscar la guerra y la expansión. Es decir, en pocas palabras, nuestra shit se la pasamos al prójimo. Nuestro sesgo se lo pasamos al prójimo. Nuestro talento también se lo pasamos al prójimo. Pero tenemos que considerar esa parte. Y luego hay un estudio de Mlodinov donde habla del sesgo personal. Finalmente, el problema de los pacientes, ¿cuál es? Pues que son humanos. Y el problema de los doctores, ¿cuál es? Pues que son humanos. Tenemos sesgos de pensamiento. La frase que lo resume todo es que la mente funciona como abogado en lugar de como investigador. Cómo yo compruebo mis hipótesis asumidas y mis creencias en lugar de realmente entender el holos. ¿Creen ustedes que está fingiendo que cometió un error el árbitro? No. ¿Lo cometió? Pues no sé, pero puede que no. Entonces, para ir cerrando, este movimiento holístico de medicina funcional no es ajeno a la medicina. Lo estamos viendo en las empresas, en las organizaciones, en los think tanks de compañías mundiales y en países. El abordaje sistémico. Cómo regresamos a agarrar las ventajas de la especialización, pero no comprar el dark side. Entonces, pues aquí hay algunos libros, el mejor es este está en español, si lo prefieren, pero quiero que sientan que están dentro de un movimiento global de vanguardia, sin duda, que pertenece a muchas disciplinas y se está trasminando en gestión de empresas y de organizaciones mundiales, inclusive ONGs. Aquí la pregunta, and this was a question I was going to ask Dr. Guarneri, si tenemos quantum physics, quantum chips, quantum computers, quantic algorithms, is there the possibility to have quantic medicine sometime? Sounds really cool. What I'm trying to stress here is that this is not necessarily where the buck stops. No es que ya acabamos, ya encontramos la solución. Es un paso más a seguir avanzando en la belleza del misterio del ser humano. O sea, realmente, qué bueno que lo estamos haciendo aquí en Monterrey. Me da mucho orgullo todo lo que ha hecho TecSalud. Y lo que quiero decir es, pero no se acaba esto. Yo espero que las siguientes generaciones estén reunidas, quizás, maybe talking about quantum medicine. We must continue and pursue the unknown and the beauty of the mysteries of life. Cierro. This is my last. Y aquí es un planteamiento que les hago. A ver, venimos del pensamiento mecánico, del enfoque causa-efecto, del método científico y el abordaje es la intervención del síntoma. Llevamos ahí, ¿qué les gustan? 600 años. Luego entramos al pensamiento abstracto, el pensamiento sistémico, el holos, el Gestalt. El enfoque es orgánico, el método es sistémico y el abordaje es el entero. ¿Será que en el futuro el pensamiento tiene que migrar de lo mecánico, al abstracto, a lo cuántico? El enfoque fusión, el chamán informado, el chamán educado, método cuántico, a lo mejor alguna de ustedes lo desarrolla. Y el abordaje, pues ya lo mencionó la doctora, la epigenética y la famosa biología de la creencia. ¿Será que el génesis de la salud empieza primero que nada en lo que creemos? Entonces la cosa se pone más complicada y más divertida. Cerrando, esta es la penúltima filmina, leyendo a este señor, Ni Huang Xin, hace como unos 25 años, me llamó la atención el taoísmo. Y el taoísmo, pues, es una filosofía milenaria, y entre sus libros encontré una anécdota muy bella, que decía esto. En la antigua China, en una región, al médico se le pagaba una mensualidad mientras la familia estuviera sana y vital. En el momento en que alguien se enfermaba o se sentía mal, le suspendían la iguala. ¡Qué belleza! Quizás ese sea el futuro. Gracias.
Muchas gracias a Horacio Marchand. Vamos a pasar así.
Esa es la más dura de todas.
Vamos a pasar con Pilar Caballero y vamos a ver una semblanza de ella.
Sí.
Pilar Caballero. Pilar Caballero es neuropsicóloga. Trabaja en el ámbito de neuropsicología clínica utilizando la neuroretroalimentación, neurofeedback, biorretroalimentación, biofeedback, y el mindfulness como apoyo terapéutico en el Centro Terapéutico Multidisciplinario Redes. Pilar estudió la licenciatura en psicología en la Universidad de Monterrey y posteriormente una maestría en neurociencias y neuropsicología en la Universidad de Sevilla, España. Su interés por los temas relacionados al mindfulness comenzaron desde el 2013 y fue entonces que decidió estudiar su segunda especialidad como maestra de reducción de estrés basado en mindfulness. Apoyada tanto por la formación de la Escuela Médica de Massachusetts, Estados Unidos, como por el Instituto Mexicano de Mindfulness ubicado en la Ciudad de México. Adicional a su práctica privada, ofrece conferencias, cursos y talleres formativos en mindfulness a empresas y particulares. Ha ofrecido sus servicios a empresas como Anchor Relo, Grupo Clever, Secom, San Roberto International School y Heineken 360. Bienvenida, Pilar.
Gracias. Sí estamos, ¿verdad? Muy bien, gracias a todos por lo que se ha compartido. Thank you for everything you've shared and for this time being with us. And yesterday's talk was really informative and interesting. Thank you all. And thank you for the introduction. Tania, thank you for welcoming me to the group. I'm going to switch this to Spanish just so I have enough energy when the day ends, okay? Lo de Chipinque lo mencionamos una vez. Desde que Tania me invitó a todo este proyecto, la verdad es que yo he estado muy entusiasmada. Para mí la palabra que más se me viene a la mente es refreshing, ¿no? Tener este conjunto o esta colaboración entre medicina tradicional y todo esto que hacemos el grupo que vamos ahora a integrar el Health for Life. Y dentro de las cosas que hemos intentado, una de las cosas que me invitó Tania al principio, empezamos a llevar grupos en el que justo nos acompañó Horacio en una de estas idas a Chipinque. Y entonces hacíamos una combinación muy interesante entre terapia de bosque y luego hacíamos una meditación en medio de Chipinque. La verdad es que la actividad se sentía muy bien, el grupo iba entusiasmado, nosotras también íbamos emocionadas y había mucho interés por parte del grupo y bueno, ya saben, ¿no? Cuando están en un escenario como ese, rodeada de bosque y como que te desconectas de la ciudad, cambia el ritmo, hay luz y hay sol y hay viento y hay árboles y todo esto que hay ahí, te llena de energía, ¿no? O sea, yo siempre le digo a mis pacientes que tenemos un bote de energía, un bote de gasolina, y se drena o se llena según lo que vamos haciendo en la vida diaria. Este tipo de actividades, como la terapia bosque, es algo que nos llena este bote de gasolina, ¿no? Las decisiones que tomamos durante nuestro día y nuestra vida, nuestros hábitos, de esto depende si este bote se drena o se llena. Esto para mí definitivamente es algo que me súper llena mi botecito de gasolina. Estamos con nuestras bolsitas, nuestro regalito de la terapia, y ahí está el grupo, ¿no? Entonces caminábamos a gusto platicando y todo y entrábamos como una media hora más o menos. El chiste no era tanto como elevar el ritmo cardíaco y hacer ejercicio, sino simplemente sumergirte, desconectarte, entrar y luego hacer una meditación en medio de chipinque. Y así lo hicimos varias veces. Y bueno, espero que lo podamos seguir haciendo, ¿no? Esa era la idea. ¿Qué pero me le ponen esto, no? A este escenario, estar caminando ahí es como un despeje total y más si lo hacemos entre semana y así. Entonces, yo creo que el esfuerzo de todos nosotros es una invitación para empezar a hacer justo más este tipo de actividades y no olvidarnos de que somos un ser con muchas necesidades y que no solo podemos trabajar y que no solo podemos relajarnos y no solo podemos hacer ejercicio y no solo podemos estar en tema social, sino que lo importante en nuestro ser y nuestro mismo organismo, nos lo dice constantemente, es el balance. Creo que en el balance de las cosas está donde está la sabiduría real, ¿no? Fisiológica y emocional y espiritual de la que hablaban las doctoras. Entonces los invito, justo hablando de este balance y de esta conexión y de balancear nuestro sistema nervioso para balancear el sistema simpático y parasimpático. Nosotros normalmente a nuestros pacientes no necesitamos enseñarles a activar el sistema simpático, ¿no? Que es el que libera el cortisol y es el del estrés, pero sí hay que recordarnos cómo activar este otro sistema parasimpático. Como quieran, como lo podemos hacer como sea. ¿La quitamos o la dejamos? Ok. Entonces los voy a invitar a activar este sistema parasimpático, sí, que es la otra parte de nuestro sistema autónomo, que nos va a ayudar a balancear todo nuestro organismo, nuestro sistema nervioso. Para esto les voy a pedir que se pongan en una posición cómoda. No hay que hacer grandes ajustes, simplemente acomodar bien las piernas sobre el suelo, las plantas de los pies bien puestos sobre el suelo, las rodillas a 90 grados, que cuidar nuestra postura, ¿verdad? La espalda recta pero no rígida, ¿ok? No queremos una postura exagerada en la que le hacemos esto a la columna vertebral, sino como si te jalaran ligeramente con un hilo de la cabeza y encontramos un punto medio entre estar totalmente rígido y estar jorobado. Entonces busquen ese punto medio para ustedes y vamos a bajar la barbilla ligeramente hacia el pecho. He visto mucho que en meditación una postura común es hacer algo como esto, ¿no? Pero esto no es una postura natural para el cuello. Entonces bajamos un poco la barbilla hacia el pecho. Y los brazos los dejamos caer sobre las piernas y podemos poner las manos hacia arriba de esta manera. Tal vez nos da un poco más de sensación o las podemos dejar hacia abajo sobre nuestras piernas, ¿sí? La idea es buscar una postura que tenga un balance entre estar alertas y estar relajados, ¿no? Si estamos muy relajados nos dormimos y si es una postura en la que estamos muy alertas, entonces también estamos inquietos. Entonces vamos a buscar un balance, valga la redundancia con el balance, en nuestra postura entre estas dos cuestiones. Y cuando estén listos pueden dejar su mirada hacia el suelo y finalmente cerrar los ojos. Vamos a tomar unas respiraciones ligeramente más profundas de su respiración habitual. Puedes tomar cuantas respiraciones necesites en este momento para entrar en un estado de mayor relajación, de mayor ecuanimidad. Lleva toda tu atención a la sensación de la postura en la que estás. Intenta usar sensaciones, simplemente observar y notar cómo se siente estar sentado o sentada en esta postura. Y tal vez observar los puntos de contacto de la superficie con tu cuerpo, la planta de los pies, tus piernas sostenidas por la silla. Tu espalda baja tocando el respaldo, tus manos sobre tus piernas, intentando estar tan presente como puedas, tan concentrada, concentrado como puedas. Conectando y aterrizando con tu cuerpo. Y simplemente estando, simplemente notando. Y ahora puedes llevar toda tu atención a la sensación de la respiración. Conectando unas respiraciones. Y al inhalar, sabiendo que estás inhalando. Y al inhalar, sabiendo que estás exhalando. Simplemente sintiendo, simplemente estando presente. Y si te sientes distraída o distraído, lo cual es totalmente natural, simplemente regresa suavemente a tu respiración y tal vez al inhalar puedes usar una palabra como inhalo y al exhalar decir exhalo para mantenerte más presente. ¿Dónde está tu mente en este momento? Intenta seguir conectando con tu cuerpo. Respirando de manera natural, permitiendo que el aire venga y vaya. Y al conectar con nuestra respiración y al conectar con nuestro cuerpo, somos capaces de activar nuestro sistema parasimpático. Somos capaces de vivir y estar en el presente y dejar de estar en nuestra mente, en nuestras preocupaciones, en aquello que nos estresa, en aquello del futuro. Mientras más presente logres estar, más tranquila, más tranquilo vas a estar. Pueden ir abriendo los ojos lentamente, dejando entrar un poco de luz para irse reincorporando en este momento y en este día. Y aunque ya hayamos terminado la práctica, los invito a que observen qué sensaciones deja esta práctica en ustedes y que noten que está presente, que antes no estaba, que está ausente, que antes estaba. Y simplemente conectar con su cuerpo cada vez más, que al final es yo creo que la intención por la que estamos todos aquí. Espero que hayan disfrutado y se hayan relajado. Gracias.
Tania.
Para cerrar, vamos a invitar a Sven Boes, es nuestro director de todo el sistema de TecSalud, para darnos unas palabras de cierre.
Gracias, Tania. Unas breves palabras para que podamos subir al quinto piso y vean qué bonito nos quedó, la verdad. Pues buenos días, un gusto saludarlos. Agradecemos esta buena energía que se encuentra aquí y la presencia de todos los que se tomaron un tiempo de su agenda para acompañarnos el día de hoy. En particular, quiero agradecer la presencia de Mimi Guarneri, de Tabitha Parker y de Raoni King, así como del presidente de nuestro consejo, el señor Tomás Lozano, a quienes agradecemos su asistencia el día de hoy. Tomás Milmo. Sigo en otro hospital, perdón, qué pena. Yo sí me quedé dormido con esto. Bien, nuestro propósito es seguir impulsando el movimiento hacia una cultura de salud proactiva y no reactiva. Más que un estado, reconocemos a la salud como un movimiento continuo, consciente y colectivo. Buscamos un enfoque de bienestar integral, abordando las necesidades particulares de cada uno de nuestros pacientes desde una perspectiva multidisciplinaria. Estamos convencidos que una buena salud constituye el vehículo fundamental que le permite a las personas disfrutar de una manera más plena su vida. En las últimas décadas, no solo en México, sino a nivel mundial, ha habido un desplazamiento de los padecimientos en salud hacia enfermedades crónicas, como son la diabetes, el cáncer, las enfermedades cardiovasculares y las enfermedades mentales. México es de los países más altos en pérdida de años potenciales vividos por muerte prematura de causas prevenibles. La tecnología es cada vez más avanzada y los diagnósticos se vuelven más complejos. Sin embargo, también aumentan las expectativas de los pacientes y profesionales hacia una curación de estas enfermedades. Esta complejidad se ve reflejada además en los procesos de atención, donde la experiencia de muchos pacientes es la de entrar a un sistema fragmentado, en donde el equipo de salud no es un todo y donde navegar por el proceso se vuelve muy complicado y costoso, pues la morbilidad que ocasionan genera gastos que muchas veces deben ser sufragados por el bolsillo de las familias. Nuestro compromiso es ofrecer un sistema integral de atención que permita en conjunto con el manejo convencional dar más herramientas de autocuidado a las personas, empoderamiento y educación para que ayudemos a las personas a mejorar su salud. Es un placer para nosotros dar por inaugurado Health for Life, un nuevo espacio que busca promover y tangibilizar los pilares de TecSalud que son bienestar, prevención y longevidad, para fomentar así una vida sana en cada uno de nuestros pacientes y de la comunidad en general. Iniciativas como esta promueven la salud colectiva, por lo que estamos convencidos de que al unir esfuerzos y generar alianzas estratégicas, podremos tener grandes resultados en beneficio de la población. Bienvenidos a una nueva cultura de salud, bienvenidos a Health for Life. Muchas gracias.
Bueno, pues muchas gracias a todos por su asistencia. Con esto damos por terminado el evento aquí. Vamos a ir subiendo de manera grupal para conocer el quinto piso. Entonces, según el color que traigan, los vamos a ir llamando. Mientras tanto, pueden disfrutar del ambiguo que está aquí afuera. Sí, nosotros podemos... van primero. Sí, si quieren podemos... Sí. ¿Quieren nada más una fotografía del equipo? Como lo queremos hacer.
A ver, sí, ¿sabes qué? En el mismo llevado, si quieres ya me estás pidiendo, por favor. Gracias. No, pues estamos un poco más. Más que los invitados. Sí. O sea, nada más los invitados por este lado. Tania. Ah.